The real advance that's happened in my lifetime in the management of atopic dermatitis has been Dupilumab, which blocks the receptor for both interleukin-4 and interleukin-13. In phase 3 studies, they looked at the percentage of patients who achieved at least a 2-grade improvement in their investigator global assessment, and you see nearly 40% of patients are reaching that level of success. Now, that's a high level of success, and I think it underestimates the true clinical benefit of the drug, as we'll discuss. Improvements of 75% on an EASI score, an eczema area and severity index score, was achieved by a higher number of patients. Another reason I think this underestimates what we see in clinical practice is because this is a monotherapy study. We're not giving people topical corticosteroids to say use on their worst, most lichenified lesions, and if we did, I think we would see even much greater improvement. In the Dupilumab phase 3 trials, there was greater improvement with Dupilumab compared to placebo regarding the itching, the sleep, and the anxiety and depression, quality of life as well. In the study, rescue medication was used by a certain fraction of patients. In the Dupilumab group, it was only about 20% of patients. And I think what that means is that if you give somebody Dupilumab, 80% of them are going to do well enough that they wouldn't need a rescue medicine. And in real life, there's no rule against giving people rescue medicines like topical corticosteroids and other options. And so I think in clinical practice, it's been our experience that the efficacy rate is really very, very high for the use of Dupilumab in patients with atopic dermatitis. Adverse events were recorded, and you can look at the serious adverse events and see that looks like it might be even a little less than placebo. You often find serious adverse event rates with really effective treatments that are less than the placebo group. And I think what's happening in that situation is that when patients are doing really well on a drug in a clinical trial, they don't want to stop. And so they may not be as quick to report adverse events as people in the placebo group who are still suffering. Injection site reactions were more common than with placebo, but that's really about it. You see a low rate of conjunctivitis, maybe something like 1 in every 10 or 20 patients having some kind of conjunctivitis.